Hi, my name is Aliyah Wright, and my capstone topic is racial health disparities in the healthcare system. This topic is important because it's important to acknowledge that there are racial health disparities in the healthcare system. Although things are better than they were centuries ago, everyone does not have equal access to healthcare. As a minority, it is important to me that inequities and inequalities are acknowledged. There are so many people who do not know or recognize that there are issues in our healthcare system. I personally have experienced discrimination in the healthcare system because of my race or my gender, and it's doesn't feel good and it's not fair. And this is a topic that should really be tackled head on. For my literature review, I used the books Medical Apartheid, Just Medicine, and Killing the Black Body. All three works focus on the plight of Black people in the healthcare system, dating back to slavery and through segregation until now. Literature that I used for my literature review focused on socioeconomic status, race, and gender, and how these factors play a role in racial health disparities. Intersectionality allows us to look at social identities and systems of discrimination. Socioeconomic status, gender, and race all need to be considered when discussing disparities in the healthcare system. For the sake of this paper, when I talk about socioeconomic status and how it affects its contribution to health disparities in the healthcare system, we're talking about access to healthcare, affordability of healthcare, and social determinants of health. When we talk about race and its contribution to disparities in the healthcare system, I mean treatment of Black and white people by medical personnel, the amount of personnel who share the same identity as minority patients. And when we talk about gender for the sake of this paper, I'm focusing on who takes care of their health, who takes better care of their health, who gets better treatment, the amount of medical personnel that identify with their patients. As far as race goes, the majority of doctors in the healthcare field and other medical personnel in the healthcare field tend to be white males. Their studies also showed that women are more likely to take care of their health, but women also have issues with male doctors not taking them seriously when they go to the doctor or not really understanding their issues. Socioeconomic status, people of low income have a hard time getting to doctors. They also have poorer health and worse social determinants of health. And it's hard for people to afford healthcare if they're of low income status, or people of high income status can afford any type of healthcare they want. In my findings, I found that 13% of the US population is Black or African American. 53.2% of the Black population is Black women ages 18 and over. 7.1% of Black people accepted to medical school in 2018-19 school year. 60.8% of Black matriculating students were women in the 2018-19 year, and Black men made up 39.2%. 55.7% of Black people have private health insurance, and 43% have public health insurance, and that was from the 2019 census. When talking about this topic, you have to acknowledge that there are not many Black doctors, and that comes from schooling. So you can tell by these statistics that only 7.1% of Black students are accepted to medical school, and the percent may be a little lower for the ones that actually go. The 60.8% of Black matriculating students is just of all Black students. It's not an overall number. For my second section in my findings, I focused on diseases and ailments. Black people tend to be disproportionately affected by diseases and ailments based on social determinants of health and healthcare status. So the first one I focused on was diabetes. I focused on age groups 18 and over. 13.4% of Black men and 12.7% of Black women were diagnosed with diabetes in 2018, while 8.7% of white men and 7.5% of white women were diagnosed with diabetes the same year. 39.3% of Black women and men and women were died because of diabetes, and 18.9% of white men and women died of diabetes. When looking at these numbers, you can see the significance between within the race, between men and women within a race, and between races overall. The death rate for Black men and women that had diabetes is significantly higher than white men and women. And hypertension is another disease, well, an ailment that I focused on. Black people are 50% more likely to have hypertension than white people. Hypertension is an ailment that can lead to more dangerous diseases like heart disease or even death. Black people are more likely than white people to not have their blood pressure controlled. The next one I focused on was heart disease. Heart disease is the leading cause of death in the United States, but Black Americans are 30% more likely to die from heart disease. Usually, people that have had diabetes, hypertension, or high cholesterol or obesity end up getting heart disease. 270.6 per 100,000 Black men died from heart disease, and 168.6 per 100,000 Black women died from heart disease in 2018. 213 per 100,000 white men died from heart disease, and 130.7 per 100,000 white women died from heart disease. And also when looking at these numbers, you can see the significant differences between the races and how Black people have significantly more higher deaths than white men and women. People that had heart disease simultaneously had high rates of hypertension. Black maternal health was another topic that I focused on. Black women have the highest infant mortality rate in the United States. The infant mortality rate for Black women is 2.3 times higher than white women. Common causes of infant mortality are low birth weight / preterm birth, or SIDS, sudden infant death syndrome. These statistics here show the infant mortality rate in the year 2017, which is a very big difference between the numbers for Black women and white women. In the following year, the number did go down for Black women, but it only went down to 10.75 per 1,000 live births. 66% of Black women received prenatal care in 2017, while 82.4% of white women received prenatal care. And Black women are more likely to receive late or no prenatal care at all. And this has to do with healthcare access, transportation, living conditions, and other social determinants of health like smoking. Black women under the age of 20 and between the ages of 40 and 54 have the highest infant mortality rate. Black women, when it comes to Black maternal health, Black women are often not listened to, or they're being dismissed by doctors. And that has, in recent years, I've heard it becoming more of a problem, and more people losing their children, or many people not knowing they're pregnant because their physicians aren't listening to them, and that's not okay. In my third finding section, I talked about mental health. Black people living below the poverty line most likely to report psychological distress. 18% of Black people were living below the poverty line in 2019, which is very surprising because Black people are only 13% of the United States population. The second leading cause of death for African Americans in 2017 was suicide. for people, Black Americans ages 15 to 24. White people showed higher rates of serious psychological distress and suicide rates, but the numbers were not too far apart. 8.7% of Black adults received mental health services, and 15.7% of white people received services in 2018. Black people are more likely to be diagnosed with schizophrenia, but not offered medication at the same rate as white people, which also shows the discrimination between the client and the mental health professional. Due to the lack of cultural competence, African-American clients tend to receive poorer quality healthcare, which is very unfortunate. A lack of cultural competence discourages African-Americans from seeking mental health services at all, as well as stigmas. We know that Black men are, one stigma of Black men is that they're hypermasculine, and men that are hypermasculine or that we claim are hypermasculine are trying not to show that they have emotions and that they're big and they're tough and that they can handle it, so that they don't look, quote, weak. They won't go seek mental health services even if they need it. Black African Americans also don't trust their mental health professionals who do not identify with them, won't understand them and their stories. Also, there are not many Black mental health professionals in the field, which is pretty discouraging. The findings support the information that was mentioned in the literature review. We saw that intersectionality of socioeconomic status, race, and gender, and how these factors play a role in racial health disparities. It is almost impossible to discuss one without mentioning the others. Racial health disparities are the result of years of slavery and segregation. These disparities have been addressed and acknowledged, but there needs to be more action done by the powerful institutions who created this issue. And that concludes my presentation.